Hello, my name is Nicole Schechter, and I'm a rehabilitation psychologist in the Department of Physical Medicine and Rehabilitation at Johns Hopkins. I didn't find rehabilitation psychology until later in my training. Initially, I was working with individuals with post-traumatic stress disorder at the VA, and I realized that there was this very strong pattern of folks that had psychological trauma, PTSD, and also a physical trauma, whether it was an amputation or a brain injury or a spinal cord injury. And I found it so interesting and oftentimes painful how closely connected the psychological trauma and the physical trauma were and how they both together impacted that individual. Rehab psychology connects those two things. We work with people to enhance their emotional self and their cognitive self so that their body, their physical disability or injury or illness can recover quicker. In terms of my research, I focus primarily on better understanding the impact of the relationship between a healthcare provider and a patient. So I specifically teach people communication skills to providers throughout Hopkins, nurses, physicians, psychologists, the entire care continuum that should better help their patients engage in their own healthcare and help the patients also feel more understood and more heard in their interactions with healthcare providers. In terms of my philosophy of patient care, I believe that patient care should be patient-centered. That means that the patient should be the driver of their own care. In order to provide the best care possible, we need to focus on what the patient wants, what the patient needs, which involves understanding their family context, their history, their values, what they want out of life, both in the short term and in the long term. And when we understand a patient in full, then we can provide them the best treatment available.